Hello everyone, I'm Wendy Chui. I'm a pharmacist that works in Ontario. Today I'm here to introduce you to some of the specific pharmacy services that can be of use to you as a caregiver and also as a consumer. Pharmacists and different pharmacy can be a great partners to assist you in providing the additional services when you are taking care of your seniors at home. One of the special services that maybe not every single pharmacy can provide is something called a dispill system. Basically, for seniors that cannot remember, may be very forgetful, we worry about overdosing or underdosing. We would like our pharmacists to put their regular medication into 4 different time slots: breakfast, lunch, dinner, and bedtime. And with system like this, for the patients who is responsible for taking care of themselves, or even the caregiver, it's easy to see if the patient has taken that particular dose at that moment. And the flexibility of this system is you can actually take them apart. And so if you're going out for dinner, you can take that dose with you. If you are traveling and going away for 3 weeks and visiting another children in a different part of Canada, you can actually take that with you instead of taking the whole bulky system. So the flexibility and the safety of such a system would be a great service in providing care for seniors. Now that's something that's probably more available and more in a lot of pharmacy. There are some other specific pharmacy services that is less common and readily available, but they're everywhere for you to find. That is the compounding pharmacy. In compounding pharmacy, because we have a very clean facility, we have different equipments to prepare medications that are very useful for senior. One example is seniors are taking so many medication, a lot of side effects, and a lot of side effects happens in the stomach. And in order for us to minimize that, patient may not be able to tolerate a lot of the painkillers. So compounding pharmacy such as this one can create a medication specifically for that patient, put it into a topical gel or liquid, and that particular patient, if they have aches and pains in their joint, they can quickly put it on. The dosage will be specifically 5 drops in that joint, rub 3 times a day, and they can actually get a lot of relief and pain relief by using the topical. And using topical, the GI, the gastric side effects, the stomach side effects will be totally eliminated. Now that's one example. And another example would be a senior that is kind of frail. Their body weight is very, very low. They are very small, and the regular dosage of a particular medication that is available in the pharmacy is too big for them, and they're in capsules form. We cannot split it. So in compounding pharmacy, we can actually create a much smaller dose and put it into capsule form for that particular patient, so they don't have to either do without or fiddle with that particular thing. It can be an oral medication that into a suspension format, or a spray. Now, where is a spray going to be useful? A senior may be gone through radiation therapy, chemotherapy. Their saliva production has been totally decreased. And so drinking fluid all the time is not a solution. So a compounding pharmacy like this can actually create an artificial saliva, and the patient can just carry this around and spray into their mouth and create a much more comfortable environment and healthier environment, because without saliva, there will be a lot of problem and disease that comes into play in the oral pharynx area, and infection and discomfort can happen. So in terms of other things, like nasal spray or topical gel for situation where a senior cannot sleep and they don't want to take an oral medication. And so we've, in this particular pharmacy, we've created a gel with a normal hormone called melatonin. And the patient does not have to take it orally. And it can bypass all the requirement for the patients to absorb it into the stomach, going through the liver for some kind of excretion before it gets to the brain to work. We can compound it into a gel form, and when we tell them to do one click at a time, the exact doses can be applied onto the neck right before bedtime. And with this particular medication, if the right dose is applied on the neck where the blood flow is, within half an hour the patient will be falling asleep, and this would create, it would be much easier than taking more and more medication for the patient. So in a nutshell, I just wanted to give everyone an idea that there is something called compounding pharmacy out there that can help you better take care of your senior, or even for young children who cannot tolerate certain flavor or certain type of medication. If they're allergic to certain things, we can tailor-made it in this type of pharmacy for anybody in your family, seniors, children, or even your pets, cats and dogs. So that would be my message for today. Thank you.